Hello, this is Marquel Thomas, and my topic for the week is intussusception. Intussusception is a condition that occurs when one part of the intestine is folded into other parts. This disorder usually affects small bowels, majority the ileum and the cecum, and occasionally large bowels are involved. It is one of the most frequent causes of bowel obstructions in young children. This condition occurs between the ages of 5 and 10 months old and is a common reason for intestinal obstruction in children. Pathophysiology. In the majority of cases, the underlying reason for intussusception is unknown. Some factors increase its risk, such as viral or bacterial infections. The part of the intestine that enters another intestine is derived from blood supply, thereby resulting in ischemia and pain. Moreover, ischemia leads to impairment of the mucosal layer of the intestines that manifests with bloody stools. Therefore, in the pathophysiology of intussusception, the major role is played by ischemia of the squeezed intestine. Intussusception presents with continuous or recurrent severe abdominal pain. The child may be found lying with the legs crumpled to the chest because of pain. They also may have some nausea and vomiting due to violation of passage of blood and stool, and also may have some bloody jelly-like stools. They may cry, experience distress, have some dyspnea in episodes of pain. The abdomen will be soft sausage-shaped formation may be found, and it may be tense and painful to palpation. Dance signs occurs when the right upper quadrant of the abdomen retracts on palpation. The first diagnostic method is radiograph of the abdomen, which typically reveals air-filled fluid levels, amount of air in the cecum, a crescent sign with protrusion of small bowels into large bowels, and in some cases, signs of gas in the abdomen. Ultrasound of the abdomen may be preferred over X-ray due to detection of the donut sign. Through experience and interpretation may be required. Finally, a CT scan should be administered only in complicated cases with the necessity of a differential diagnosis. Finally, air enema maneuver is used for both differential diagnosis and treatment, and it effectively eliminates symptoms. The treatment of intussusception involves an enema with air, water, or barium solutions. Enemas with any substance are efficient in 80% of cases. However, sometimes the condition may still reoccur in 24 hours. In cases where the enema is not effective or if complications develop, then surgery may become necessary. Surgical options include a laparoscopic separation of some of the intestine parts, a laparectomy, and manual squeezing of the intestines also. The patient should also have antibiotics to cover potential intestinal perforation. The parents should be educated about symptoms of reoccurring intussusception and complications of surgery. These parents should be educated on what to look for in case this condition reoccurs. They should be educated on complications from surgery if the child has had surgery. These complications include fever, vomiting, leakage of blood from the wound, and some weakness. Parents need to be educated also that follow-ups will be crucial for at least 24 to 48 hours to exclude possible reoccurrence of intussusception. The necessity of further follow-ups for uncomplicated cases is not indicated. After surgery, the next follow-up is scheduled in 3 to 4 months. If during the diagnostic of intussusception, Meckel's diverticulum or other pathology is suspected, then the patient will need to be referred to a GI.